we're going into our presentation number 4, so we're taking down our blood pressure, our heart rate, our cholesterol and everything. We're taking it down. We're getting back to our notes, our note-taking. Presentation 4, succession planning, financial legacy. And of course, this is brought to you by Sagicor. And all of this talks of health is wellness and all of these things. We also have to be financially healthy in all that is happening. And so we welcome Professor Denise Eldermire Shearer, who will be the presenter for succession planning, financial legacy, and she joins us by Zoom.
I envisage my legacy to have been raising awareness about aging for individuals and for society, and to empower people to age actively and well, and to take responsibility for growing older well. I grew up being taught that you have to have a responsibility to society, to yourself, and therefore to enrich yourself and others around you.
God's country.
Good afternoon, everyone, and congrats to all of the organizers of this event, despite its hiccups of pulling it off and reaching so many people. I'm going to look at retirement planning next. And the objectives as we go through this presentation will be to look at the growth trends of Jamaica's senior population, the 60 plus. I will do a very quick situational analysis so that we realize where we're at. And as our moderator said, I will touch on aspects of financial literacy and the essential factors for successful transition into retirement. Next. So we can't talk about retirement without talking about aging, as you would have noticed in my introduction that the focus would be aging. It's the partner of retirement, because most of us have to retire due to age, because there's a retirement age. A few because of health, but mainly aging. Aging is a process of education. You don't suddenly get old at 60. You learn to live, and the longer you live, the more one learns about oneself. And aging is really about the development of self. And that's why it's such an important part of any legacy discussion, any legacy workshop. Next. Therefore, aging is a complex process. It's a normal process. It's natural. It begins at birth, not at 60. It's a process of development, yes, but with development comes change. I think perhaps the most important point here is much more than physical. It's much more than wrinkles, gray hair, or dependency. Next. As I said, it's a complex process, and therefore it involves many things. There's the physical, which takes in health, takes in ability to walk, the wrinkles, etc. But it's just as much about social and psychological. Who are your friends? How are you going to cope? Are you afraid of aging? Are you afraid of your aging process? Their spiritual comes in because we need to recognize that there are higher powers, and sometimes things are beyond our control, and to go with it. You will notice that finance is not here because finance is cross-cutting, and therefore everybody across all of the components. Where the circles overlap is where we will have successful aging. Next. The next slide is an interesting slide. It's about growing old. Aging is accompanied by a process. Some people never grow old, thank heavens. Some get very old and bedridden. So you will see that we focus on the biological age, psychological age, but much more importantly, we focus on functional age. We have many 90-year-olds who, like our dancing grandmother there, can do all of these things. And therefore, we think of aging as a process of maintaining functional age. Next. So let us now look at the Jamaican situation. Next. This slide is a slide I have been using since I did my PhD way back in '93 because it tells the story. It also tells us how long we have known that the population is aging, and it also tells us how we have been slow to recognize it and to recognize its importance. You will see that up to the year 2000, there was not much growth. We knew in the 1960s that the population had started to age, and then we have seen it growing quite dramatically. We have currently over 390,000 persons. I suspect by the time the census is finished, we will have gone over to the 400,000 mark. The other interesting thing about this slide is we were expected to get to 25% of the population by 2050. Our population is a shade under 3 million, so it is clear that we are going to achieve the 25% long before 2050, probably around 2030, 2035. Next. And this shows you the increases. So it is important. Right now, our population growth is stable. We're not increasing significantly. Yet while the total population has been at 2.9 and will probably stay around there, the older population, 60 and over, has grown by 15%. What's important is this over 80 population, because most of us, and perhaps I should say, we now talk about young old, middle old, and old. So for everybody, you're not going to be really old until you're over 80. That's the population growing at the fastest rate. Next slide. And if you look at this slide, you will see that whereas the ratio of men to women is not significant, up to age 70. By age 70, women start to outnumber men. Women have slightly different issues in retirement to men because many of today's older people weren't in the workforce, don't have a pension. Upcoming females and males are going to have less children. The tradition where there will always be a child to look after you has flown out of the window. And so one of the important things in the situational analysis is to recognize that older people are going to have fewer support systems. One of the good things, however, in the studies that we have done has shown us that the current older population is much more functionally alert and functionally well. Therefore, the need for care has somewhat decreased. That also suggests that you need to have other things in place for your retirement. Next. So let us now go on to retirement. These are the faces of our older people. Retirement is a major lifestyle change. It's a stage like any other stage, just like adolescence, and it has always intrigued me. We welcome adolescence, we welcome 21, we welcome getting our first car. I haven't heard very many people welcome being 60 and being retired. So it's something we need to think about. And there are certainly going to be changes. Your lifestyle is going to change because you're not going to have a job. So and that's separate and apart from income. It means that you will not have to get up at 7 o'clock to go to work and come home. Fine for the first couple of weeks, even months, but you're going to have 20 to 25 years in retirement. Life expectancy at age 6 is another 25 years, and we have many living to 90. You could have 30 or 40 years of time on your hands. Perceptions of yourself and, of course, your finances change. So next. There are challenges and threats that come with retirement and with aging. There are role changes. Next. There are losses. There are losses of friends, losses of spouses, the job, as I mentioned before. There are not as many opportunities for you once you're old. Workplaces don't want old people. And of course, there are physical losses. Although some of them don't wait for 60. Eyes, we've all heard about the past 40 glasses. We do know that we have to turn up the television a little bit more once we get the hearing issues. And most importantly, muscles, joints, the difficulty with arthritis and getting around. Perhaps most important are the last two. Because our families have changed, people are having children later, both men and women, and then you're growing and older. We are the sandwich generation. There are many people on this talk today that have both younger children, because young children don't move out at 17 and 18 anymore. They stay with you for university, etc. And there are many people that are grappling with the challenge of still having to find for young people, look after young people, but have elderly family members, not just parents, for responsibility. Hence, you're the meat in the sandwich, and it can be stressful. And of course, we lose power. So these are the major issues that our research at the Mona Aging and Wellness have found over time. And I've said most of them, we don't have to spend a lot of time on this slide, but the use of time is critical. The point I want to make for this slide is in all the studies that we have done, and we have asked older people, what are your major issues? They tell us loneliness. Finance and health are second and third. And so the lack of planning for this adjustment is important. And you need to know what to do, how to do it, and what support exists. Next. So how is it a legacy? Why is thinking about aging, thinking about retirement a legacy? Next. And why plan it? You plan it to give you independence and control. Remember the slide that said power, not having power. You want to ensure that the plans you put in place make you independent and not dependent on others. Your legacy is therefore the result of preparation for aging and for retirement. So what thought have you given to what this legacy is to be? Are you going to be able to look after yourself? Are you going to be able to maintain your independence? It's about whence we came and where we are. Again, the faces of older people. So the areas to plan for, as we have been talking above, but finance, health, caregiving, remember the sandwich generation, relationships. One thing that retirement does do is take away from you areas of possible relationships. Certainly the coffee break, going to the bathroom. These retirement removes those. So where are you going to make sure that you have contact, you can be useful? Housing is critical. Are all your bathrooms upstairs? What happens when you get that wonky knee? What happens if you have a stroke? Do you have a full bathroom downstairs? Are there rails in the bathrooms? These are things to think about, and I will then mention the mental health and end of life. Next. So, as for all other things, we certainly focus this on knowledge at the moment as we talk about COVID. Knowledge is the basis for planning. So health knowledge, there are many sources. Emotional knowledge, mental health is now on the front burner. There was a time that we wouldn't mention the word mental health. Mental health meant psychiatric illness, meant that you were mad. No, mental health is about happiness, it's about coping, it's about not being depressed, and it's about knowing when you need health. Spiritual knowledge comes from church. Financial literacy I will now mention. So what is financial literacy? It's critical. Let me start with that. But it's about possessing the skills and knowledge on financial matters to take effective action. It's important because it equips us with knowledge and skills to manage money. And when you're talking about aging, retirement, planning for it, you have to manage money. You're going to have to do without something so that you can put down the little nest egg. So it helps with the decisions on budgets, debit, investing, and it's the coming together of all financial matters. Next. It's important so that you can plan and so that you can ask the question, what can we not afford? And you cannot afford to not plan financially. Next. So why do persons not prepare? And we do have, Dr. McCoy Davis did her PhD on this and has a wonderful thesis on it. So the three common reasons that we were given in this study for people not contributing to pension or to an investment or to their health insurance is that I'm not earning enough to save. That is a fallacy because you may not be earning enough, but it means that if you're going to have 25 years where you have no money, so you have to balance, go back to financial literacy and making the sacrifices. Interestingly, people did say they didn't know much about it. and another 20% said they never thought about it. So it's important. So I leave you with a thought on the next slide. The challenges. It's one thing to know, but another thing to translate that into action. Thinking you're not earning enough is not good enough, and it's not a priority when it has to be. So next. Can somebody be considered financially literate if there's no corresponding supportive behavior? And I hope at the end of this talk and today's presentation, you will rethink whether you can afford not to plan. Next. Next. The next set of the conversation is going to be about health, if we can go to it. But I can talk about health without a slide. Health and being healthy, one of the biggest expenses that you will have in your later years is in fact health. Can we go back to the one before? Or if it's too much out, yes. Health, the biggest expense you will have in retirement is health. But there are things that you can do to ensure that you have maximum health. But again, that's a legacy activity because it needs to start in your 30s and your 40s. It's about movement. It's about healthy meals. It's about dietary changes so you don't get high cholesterol. The social supports, mental health is important, and stress reduction. Next. Unfortunately, we have chronic disease with the aging of our population. And this is our pattern in Jamaica, with 61% having high blood pressure. But high blood pressure does not have to cause a stroke. So this is why you need to take care of it. Arthritis, diabetes, and you also have 22% with both hypertension and diabetes. I've put the dementia figure in because I know everybody associates the aging process with their mind going. No, as you can see here, and this is the Jamaican figure, it's 7% of the 390,000 persons. I will admit that that does increase by age. So we find 3% in the 60 to 70 population. And by the time you get to 80, it's around 35%. But at least you don't have to worry about it, and don't think every time you misplace your keys that you're going demented and somebody has to look after you. Cancer is another one that we want to think about. And cancer we have got ignored during COVID, and we're not doing the checks, the PSAs, the prostate, the mammograms, the colon. Next. So healthy aging is the legacy. Healthy aging is taking the actions along the life course to ensure that you are as well as you can be at retirement. What is important about healthy aging is that it's never too late to start. So don't say, I'm now 50 and I have had a bad diet and I don't walk and I don't exercise. Start tomorrow. Next. And this one is the goal. The goal is, remember that very slide with about growing older? Functional aging. This lady is a lady in Port Maria that rides a bicycle. She's only 84 and she can even tow a young man. Next. But it's lifelong, as I keep saying. Importantly, it's not static. And health is related to both having a disease and your choices, your behavioral choices. Next. So these are the poor lifestyle choices that you need to change. And you change them slowly. You won't change them overnight, or you don't give up everything. So move a little bit more, the poor food choices. See, it says overuse of alcohol. It doesn't take alcohol away totally, but it does say stop smoking. And important knowledge again, making sure you know what your family history is and what are the possible consequences, and get the motivation to change. Next. So these are the things you want to change: the obesity, the salt, the diet, smoking, the poor skincare. Interestingly, look, this is a 2002 slide. And the reason I put it up is, if you notice, under infections, it does say no vaccination. So let us also remember our vaccinations, not just COVID, but flu, pneumonia, etc. Next. I did say we would go back to mental health, because being happy and being content in the older age, and accept the limitations, accept the cane, the walker, if that is what you need, is important. Next. So a healthy mind is one that helps you to enjoy life more. Yes, you have hiccups. Yes, you have problems. Yes, you can't do things quite as fast as you used to do them. I find I can no longer do work at 9, 10 o'clock at night, but I can still do it at 5 a.m. So it's about adjusting. It's accepting the limitations of the aging process. Most older people do get, can I go back to that one, please? I'm watching the time too, I promise you. Older people are resilient, and they handle difficult situations much better than younger people. So something positive comes with old age and getting older. Staying connected to loved ones. Sex and sexuality is different in older years. It's about companionship, it's about hugs, but it doesn't go out of the window. Keeping your body strong and living longer. Next. And enjoying good mental health. Most older people do, but it's important to focus on it. Next. One of the things as part of mental health is about being prepared for changes. Yes, the skin is going to get wrinkled. Yes, you may have a bit of sagging skin, but be prepared for these changes. Know that they are coming. And then it's important to be prepared so you can ask the question, is my change normal? Do I have to discuss this change with my primary care provider? Stay busy, have a sense of purpose, a sense of self-worth. Grandparenting is wonderful. These role changes are not all negative. Social interaction is critical, and doing things you enjoy. Next. Next. Talking about problems. Don't be ashamed. Let me tell you something, and I know this from the hundreds of older people that I interact with. Everybody has a problem and a concern. No concern is too little or unimportant. Ask questions so that you can avoid misconceptions. Not all old people get demented. Say what you feel. If you can't be corrected if you don't know. You can learn new things in old age. You can go back to school. You can do computer classes. Listen and learn, and keep in touch with yourself, with your feelings, and with the loved ones around you. Next. Don't be afraid to ask for help. Don't say, look, I'm not coping. Can we sit and talk about it? I'm not dealing with this retirement story. I have people that get dressed and go to work every day as if they were still going to work, and family members don't know. You have to face reality. Practical help. Most importantly, know what you're entitled to. The NHT benefits, they're not just for poor people, neither is NHF and JADEP. Utilize everything that you are entitled to. Next. So, retirement. What is it? It's not the end of the road. It's the beginning of your new highway. It's about new life, old life, and it's about now enjoying life. Next. So how do I do it? It should be a legacy activity. You owe it to yourself. Start it tomorrow. Revise it. I have 20 and 30-year-olds that are talking to me about retirement plans. Clearly, if you start that young, you're going to have to revise it. Next. So it's a legacy for yourself and your family. It will give you the savings, the health insurance, prevention, the healthy aspect, the healthy lifestyle. It allows you to look at friendship, support, and sense of worth. What am I going to do to occupy my time? So as we come to the end of this presentation, how do you prepare? You gather information, you clarify options, you have a plan, and you set goals. You reassess and you change as necessary. And most importantly, make sure that somebody in your family knows what you want. I am reminded of a husband and wife who were seeing me, and I had separate interviews. She couldn't wait for him to retire because she was going to travel Jamaica. She was going to go see all the things she had never seen. He couldn't wait to get in that lounge chair and watch TV and cricket. Next. So you have to reflect. What is it you want to accomplish? It may be just to be a great grandparent. It may be that you want to write a book. You might want to write other things. What am I going to do? Where am I going to live? And with whom, if anybody? Make the choice while you can. You don't want to be sick in hospital and have to go to somebody, a child or what, that you don't really get along with. Lifestyle changes and adapt to the physical changes. I keep going back to the relationships. Old age is about relationships with friends, with your church community, with your family. Next. So, as you look at your legacy, the legacy to yourself and the legacy to your family, because you don't want to be a burden. Remember the powerlessness? You don't want that. It's in your hands to ensure that you don't. And I've come to the end of the presentation.